Hello, Igor. I'm
Hello,
very
hello from
happy
Poland.
to see you. Okay. Welcome to Dr. Igor Dogocki. Okay. Sorry for my pronunciation. My pronunciation, is not the best, but he's a big friend of the magnetodynamic technology, and he's here for some answer and question about the philosophy. So the philosophy before the technique. Exactly, because I know you around the world because you use magnetic dynamic technology. You have a different concept for the normal dentist or the normal doctor approach the mouth and the human body. And for me, this one is super interesting for a lot of things. But back to the basic, I just want to give a couple of questions. Igor, you speak about immunological dentistry, okay, in your speech, as a continuous dialogue between the mouth, okay, and the immune system. Okay, this is the focus. When you first encountered the magnetodynamic and the magnetodynamic technology, what convinced you that it was consistent with your vision, with this vision?
Yes, thank you to be here, and I want to explain it happened, why I was searching for this kind of solution around the world, because it starts everything with accident. I was left side paralyzed, and the only way would what helped me was Chinese medicine. So I was student in this time, so I changed completely my focus, my vision to another solutions, because it helps me in let's say 15-20 minutes, that everything
Yeah.
was next day, everything was clear. So it opened my mind in this time when I was 22. You can imagine you are like a sponge, and it was for me the best what could happen to me, this accident. Yes. um,
Yeah.
and then I started this type of dentistry. And yeah, this is a whole huge improvement later with implantology. And for me, from the point of immunology, the bone is for me now the most important thing. And
Mhm.
and then is, of course, you want to search for a solution which is bone friendly, and
Yeah.
this is a magnetic mallet. We make a tests with different things, also with piezo surgery. But the best outcome what we have now in our clinics, we have a network of clinics, but also for our implant system, the best way is now magnetic mallet. Why? Because again, from the point of immunology, the bone, if we treat the bone in the right way, we will have a good outcome in the implantology. And finally, I use magnetic mallet. When I started, I use it only for extraction. Um, and then it was like a next step from extraction to sinus lift, from sinus lift to implantology. So
Yeah.
you have a lot of possibilities with magnetic mallet. That's why I was very happy to find such thing. And yes,
I
that's
love it. I love it. Sure. It's the bio concept I love about the magnetodynamic technology. I'm very happy to hear you. But talking about the heat is the enemy of the bone. In traditional implant placement, obviously, frictional and the heat is considered an acceptable risk. Okay, you work to prevent the jaw osteonecrosis in this case. How does the protocol change with the instruments? Then procedures is zero overeating. So, how change your protocol right now?
yeah. Finally, we understand now, since Professor Isaac Bindemann explained us how bone is remodeling. We understand that what we did the last couple of years was not the best solution. For example, heat is a big problem. I mean, when we make implant placement, we it's so easy to overheat the bone, especially when you go deeper, let's say 11 millimeters inside the bone. It became a disaster. So for me, especially in our concept, we want to prevent heat. But more important for me is the irrigation, because irrigation takes out a lot of good material, the informations of healing. So here, magnetic mallet was for me the biggest game changer. Why? Because you have the possibility to have, let's say, all the informations in place. What also very important is for me as from the point of immunology is the point that we know already that bone is very good. It's good to regenerate the bone with small impulses. What does it mean? It means that normally when you drill, you take all out the good bone, also the good bone quality. But here, what we figured out is, and there are a lot of treatment about when we're talking about artificial trauma, we call it. So small impulses stimulate the bone around. So you have a good outcome because the stimulation with magnetic mallet, with the wave of the magnetic mallet, is able to activate also around the tissue. So this is a completely new field for us, and we back to Professor Bindemann. He's talking about it many years, and I our concept is activating bone intelligence. It means don't destroy the bone, please
Yeah.
stimulate the bone, and this is the key.
Yeah, absolutely. Obviously, I agree 100% with what you said, obviously. But talking about zirconia, because you work also with zirconian implants, zirconian plus magnetodynamics, the complete metal-free system, no? You choose zirconia implants to eliminate the metal for the mouth, all the metal for the mouth. The magnetic mallet eliminates mechanical trauma in this case from the insertion. Can we say that together then from a truly biological implant protocol, from material choice to the surgical gesture? So it's zirconian and magnetic mallet, because I know you love zirconia. I love you have a factory. So you're a zirconia. I want to come a little bit more deep about zirconian and magnetic mallet.
Absolutely. So we see our future is also the combination of both. That's why our clients, when they using our implant system, they have no choice. They have to use also magnetic mallet. So in every set of our surgery set, we have already magnetic mallet, because we want to show that this is the future of dentistry. It's not only even the future, it's now. Yes, it's because we have a lot of clients, especially in Switzerland. They understand this concept very well, and they use magnetic mallet, and they are happy. Why? Because um, you have you have to be careful, especially in the implantology, when we're talking again about particles.
Mhm.
And with the drills, we have a problem that the drills, they are at the beginning very sharp, but with the time they lose the sharpness. The question is what happened with the
Sure.
particles? And here with magnetic mallet, you have this diamond-like coating. It allows
Yeah.
us to have the safety surgery, and yeah, we trust so much that even in the set, it is must have to have it. So.
Yeah, sure. You have some cases to show.
Yeah,
Okay.
oh, very. I can show you what why magnetic mallet um, change our also prosthetic part, because
Okay.
we're focusing now only on surgery, yes, but from the point of I will try to.
Okay. I
Uh,
put it up my video.
okay, can you see something?
Not yet.
Okay, let Freigabe. Okay. Here will be. Give me a second.
No problem. Okay.
Okay, so let me show you something.
Okay. Perfect.
So yes,
I
I
see
hope you can
everything.
see it. Yes. So what is very important is the shape of the Osseotouch. I mean, for the preparation of the bone, have the same size like our implant system. This is what we discussed already. So all the protocols that you have less heat, for example, visibility. I mean, everybody knows already, but I show you how it's look like. So you have in the set all the time our Osseotouch system. But what I wanted to show you
Yeah,
more.
this is, sorry if I interrupt you, is a dedicated to the implants of Meridian. So so the fitting is the best
Yes,
shape for the core of the implants.
yes, yes, yes. That's why we are showing also special in our education how to use the sequences. But where magnetic mallet is very, very powerful, this is also in the, let's say, in the aesthetic line. Why? Because in our clinics, we make only immediate implantation, so we don't wait too long. We want to make it quick. And when I show you something what is very important, and this is we talking about the prosthetic part. So not usually very often after the extraction of the tooth, we want to use the palatal root because this is sometimes the only chance to put an implant. The problem with the palatal root in such cases is that the prosthetic outcome will be not good. That's why um, we use here, especially when we want to make also internal sinus lift in the same time, we use magnetic mallet, and you can see how easy and nice it is to prepare the bone, to shape the bone, and to create a ideal space. Normally, I would go 2 years or 3 years ago. Uh, I was uh, I was naive and I was putting the implant here in this palatal root. But now with
Mhm.
magnetic mallet, I can prep it much better, as you can see here. And then I can place the implant really perfect position also um, for the prosthetic work. And as you can see, of course, we will put some PRF around it because we must have to activate our implant because our implant is not typical zirconium. It's from silicon dioxide and calcium, kalium, potassium, another story. But here it is important that we have a lot of informations around our implant. And this is after the preparation of the prosthetic part. So the protocol is very, very easy. That's why I love it also, and even the new generation of dentists, implantologists, they love it because it's very easy. So you have to start from 1 till 4 or 5. It depends which implant you use. What you can see here on the picture on the movie, and um, when it's delayed implantation, we use this last drill for the cortical bone, but and we drill only in the cortical region, and in the lower part we have perfect situation for the regeneration. So that is very, very uh, easy, let's say. And the good thing is that I mean you have a big portfolio of different tools. Um, Normally everybody starts with one tool, let's say with the like me with the extraction, and at the end you make a bone splitting. You make sinus lift. You have a lot of possibilities later with the system. So yes, um, I love it also in the front to use it because of um, what I like instead of drilling. You can see in the preparation the angulation of your work because it's a very long tool, so you have the possibility to put it in the right position, and you don't go where the tooth was before. You go more palatinal, and you have very good control with this tool. So I like it. I like it so much. And another protocol what we teaching also in our education center is We use the first tip from Osseotouch here. What you can see, this is the number one. If we have a very bad bone, let's say class 4 in the upper region, what we can do is 3 months before the real operation surgery, we can use this as a stimulation. So we put it into the area where we want to place the implant 3 months later. We activating already the bone, the macrophages and the osteoblasts. And then when the patient is coming 3 months later for our real operation, you have much better blood supply and better bone quality. So this is, you have a lot of possibilities with this system. I switch back to you.
Yeah. Thank you so much. Every time I see your presentation, and I think your colleague see you on the podium when you have your speech are with the open mouth, because every time I'm falling in love because you have a concept completely different, and I love it. At the center of your problem is the patient, and this is not just one tip. I love it. This type of approach, I think, is the next step in this generation in the dental field. But talking about the patient, okay, and we change your perspective right now. So there is a clinical case in your experience, perhaps a patient with problem of systematic inflammation or a history of implant failures, okay, where the magnetodynamic approach made a difference you didn't expect. So you see, oh, I have this type of approach, and what's happened?
So when you said it the right way. So the patient for us is the patient, of course, most important. So this is only a tool, a technique, but
Yeah.
especially in when we concentrate on the bone, because finally we remove let's say interference field from the oral cavity, but at the end we want to rebuild the real function and the true function of the patient. And I see the outcome that with magnetic mallet, you are much faster in the operation. I give you an example. I was in Dubai. We made some surgery, implantology, and there was a patient from United States. He had before the option and also implantation was some failure implantation. So we came like SOS with our baggage and all this stuff. And he had before a typical drilling. And then we asked him after the surgery with magnetic mallet, with our system, how it was. And he said it is much better because uh, before when they start to drilling many years ago, he had the feeling that he is under the water. He takes so much
Yeah.
water and it was a disaster for him. But here he was he said it like a massage compared to the to
Yeah,
the to the
exactly.
first. Yes. So for me, it was a good yeah, good to see that the patients love it compared to the old, let's say, old technique. This is one thing. Second thing is again the bone. I'm very focusing on the bone, and I spent now last 2 3 years only with the bone. Also focusing with the bone means how we can improve the bone quality. And of course, there we have a lot of possibilities with supplements, but the preparation is the most important thing. We need also, and this is very important, and we communicate it every time, we need small inflammation at the beginning, because the small inflammation activating the next step for the regeneration.
Sure.
So that's why I would say when I go to when I have the option to go to the island, lonely island, I will took my wife, magnetic mallet, and and maybe uh, and maybe let's say um, a beer. from Poland.
The beer is also important. Talking about the future of the conservative surgery, I don't want to interrupt you. The segment therapy, antioxidant protocol, zero trauma instrumentation like a magnetic mallet. You are describing a dentistry that respects the body as a system, right? Okay, when do you see this approach in 10 years? And when does the scientific community still lack to adopt it on a large scale? Because for me, this is the question, not only for my company, but also for this type of surgery.
So we observe a very huge wave of a new trend. Somebody call it longevity, somebody call it a good life. It is now very, very popular that the people take care about the body and about increasing the life quality. And increasing life quality is not anymore to have a nice flat. It is more about how can I be active with the age of 70, 80 years old. And what we observe is that the prevention should be better than now, because we have a lot of toxins in our environment, and we have to take care about the filtration of these toxins from our body. Detoxification is here very, very important. And what we observe, for example, like peri-implantitis, all this type of treatment is you can avoid it with a good diet. When you eat when you have a good lifestyle, movement is very important, sport, but not typical like running like a horse from A to Z and watching to your watch how much record you made. The Chinese said only dogs are running, so you have to be more like that's why, for example, qigong, the small slow movements are even sometimes much better for the lymphatic system. So I think the education in the future will be that the dentist or the general doctor is not going directly through a standard protocol. It will be more personalized medicine. It means that everybody have their own system. I cannot compare to my neighbor, and this is the same in dentistry. That's why I think, and this is a very, very fast market. The longevity is growing, this concept of longevity, and we will see. But I think in 5 years, this type of conventional medicine is gone. It will be very low. The most will be creating network with another doctors to take care about the whole family of our patient.
Yeah, this is the problem also of the words, because sometimes that people talk this type in the simply way, talking about this type of concept like the holistic dentistry. I don't like, because it's much more than this. So is a 360 around the body health. Okay. And just the last question. I don't want to take a lot of your time, because I know you are in your business, you work in a lot of clinic all around Europe. Most of the clinic are uh, at the top level. But for a technical question, for a prospective standard point, how you describe the surgical feel of the magnetic mallet compared to a traditional mallet? So the traditional mallet, does the surgeon feel more or what they are doing? Because it's important, because this video, there is a lot of people have the mallet, don't have the mallet, and ask sometimes this type of questions.
Yeah, there are two. This question is very complex because it have like two persons have a benefit, the patient and the dentist. So the first, you as a dentist, you have a better quality of your work, because as again, no overheating the bone. You can stimulate the bone. But especially for the patient, what I observe is that the patients they they are more comfort with this technique, especially even extraction. I mean, how fast you can extract a tooth with magnetic mallet, it's amazing. And even in impacted teeth, you can use it. And that's why when I start with magnetic mallet, I repeat myself, but I think this is very important. For me was this at the beginning only for extraction. Later, I figured out how many possibilities you have. And if you think about the time what you save with magnetic mallet, and for extraction and implantology, because you don't need. I mean, in our clinics, we since 3 years we don't make external sinus lift anymore. I mean, this is. I think this should
This
be
is another point. It's another secret. What is possible to do?
exactly. So that's why as we have a good outcome for the patients and for the dentist, and this is very very uh, mm, yeah, not typical when you use such technique, because there are a lot of limitations in drilling, in piezo surgery, and here you have this type of technology. And what I like in the sinus lift, the patient don't have this trauma with the inner ear.
No,
So
edema, totally.
yes,
Yeah.
the wave is not going so deep. It's concentrated on the tip, so you can modulate the bone much easier. And yeah, that's why this is a win-win situation for the patient and for the dentist.
Yeah, yeah. And one last question, sorry, about the last one. But talking about a little bit more about your choose or zirconian implants, okay? Because I know you arrived at this type of concept, okay, about so natural for the respect of the body, and titanium and zirconian. What obviously because you start like everyone with titanium implants, and now you switch. And I know you believe you have amazing company. I'm completely falling in love with what you do around Europe. Good luck for everything. But which is exactly your switch point?
The switch point in my case was the patient, and also my freedom of to don't have peri-implantitis, and
Mm.
also to have easier work with the prosthetic. We decided to go completely another direction, because we're talking here about zirconia implant, but we found out that the zirconium is not the limit. So we have new materials which we're using now, and these materials are combined with magnetic mallet even better, because I was talking about activating bone intelligence. And our implant is bioactive. It means that it's interact somehow with the regeneration of the bone. It gives like it's like a supporter, let's say, and producing hydroxyapatite layer around. But to do it, it is good to have such tool like magnetic mallet, because we need a very good blood supply around our implant. And that's why for me, as a CEO of the company, I have to look for the best solutions. And finally, we found you.
Yeah. So, Igor, thank you for everything. Thank you for your time. Now, in this webinar, talk about the body nature, okay? Talking about the new solution and the futures, or maybe what is figure out for me and you the future of the dentistry, okay? And the medicine, obviously. So, thank you so much, Igor, okay? If you or someone have some question, okay, I give directly the line to you, so it's easy to reply.
Yeah. Her damit, we say in Germany, her damit. I'm
Okay,
ready. I'm ready.
thank you so much. Bye.